Chest pain, to characterize it, will be in two ways. You may look at the nature of the pain that you're having, and then of course we also have to look at the person that is having the pain. The nature of the pain will be if you have pain that is located centrally in your chest, and then maybe it feels like heaviness, a heavy feeling, crushing, and then that pain shoots to either the left part of the neck, or to the left shoulder, or to the left arm. That is described as the typical angina pain. And so no matter what your profile is, you would need to get to the emergency room so that you can be properly evaluated, particularly if this pain is then precipitated by stress, either physical in terms of exercise or emotional. Also, the person having the pain is important. If you have been previously diagnosed to have ischemic heart disease, or you've had intervention for ischemic heart disease in the past, if you develop chest pain, it's also possible, very likely, that that may also be a pointer to a heart attack or an imminent heart attack. If you also have some medical conditions, like if you suffer from hypertension, from diabetes mellitus, from chronic kidney disease, if you have cholesterol abnormalities, yes, and of course age is also important. As you grow older, the likelihood that the chest pain may be ischemic, a pointer to a heart attack, is also there. So if you are older than 55 years of age as a man, or more than 65 as a woman, it's also a pointer that you need to watch out for that pain. Importantly is also the family history. If you have a family history of premature cardiovascular disease, like somebody, a first degree relation, a man who had either a stroke or a heart attack before the age of 55, or a woman who had either stroke or heart attack before 65 years of age. So if your profile fits any of these, you need to go to a good emergency room, a good emergency unit, and at Iwosan Lagoon Hospital will present you that opportunity, because we have the personnel, we also have the profile in place and the protocol in place to be able to do that. Usually when you get to the emergency room with this kind of complaints, you will need to do an ECG. You may also need to carry out some blood tests. We call them the cardiac enzymes, which is a marker of injury to the heart. If you also need imaging, we have a good CT machine that can do an angiography, that's a dye test, to look at the integrity of the vessel taking blood to your heart. And after that, we then determine what type of intervention you need: lifestyle modification, medication, or if you need to have that clot obstructing the coronary artery, if you need to have that removed urgently, we can do that with medications. Also catheter use, that is just from the surface without having to carry out surgery or surgical intervention. So whatever your profile is, we are positioned, we are doing our best to be able to meet our promise to you that we will look after you.